My name is Katie Smoot, and this is the informative speech. I am informing you about celiac disease. Have you ever thought about the food you eat and what it is doing to your body? Ever since I was a little girl, I always had stomach complications, but never putting together that it was after I would eat. After going to many doctors and being diagnosed with many different diseases, they finally tested me and discovered I had celiac disease. According to dictionary.com, celiac disease is a hereditary digestive disorder involving intolerance to the protein gluten. An intolerance to protein gluten consists of wheat, barley, oats, and rye. The villi on the small intestine cannot absorb the nutrients, which then do not allow the nutrients to flow into the bloodstream. This picture, there's 4 different pictures. The first 2, this is a picture of the outside of a small intestine, and this is a normal small intestine without celiac disease. This is the inside, and these are showing the villi, which are normal without celiac disease. This bottom picture shows a small intestine with celiac disease, and you can see how it is red and kind of raw, and that is due to the villi. And this is a picture of the inside, or closer up on the small intestine, where you can see all these little purple and pink things that are up here, they're gone. And that's what happens with celiac disease, they are rubbed off. Important factors when learning about celiac disease are the symptoms, progression, treatment, if a cure is possible, and lifelong implications. Celiac disease was first introduced to human knowledge as far back in history as 250 AD. Arrhenius of Cappadocia first discovered the disease. In 1856, descriptions were found that he wrote about his patients. He referred to them as colochias, which meant suffering in the bowels. Dr. Samuel G. discovered the only treatment that would help, and that is a gluten-free diet. He was a doctor at a children's hospital in the United Kingdom. There are no scientific discoveries or causes that helped discover celiac disease. Celiac disease was only discovered due to pure repetitiveness of symptoms from patients. As time went on and new discoveries were made, scientific equipment came into play. The scientific equipment they use now are to do the intestinal scopes, which is what I showed you in the picture. They do that to see what your villi look like. They also can do a blood test to see if you have the genes for celiac disease. Celiac Spur Association says that the most obvious symptoms are gas, recurring abdominal bloating or abdominal pain, and chronic diarrhea. The not as noticeable symptoms that go along with celiac disease are weight loss or gain, fatigue, unexplained anemia, bone or joint pain, osteoporosis, and behavioral changes are just a few. The progression of celiac disease can be held off by staying on the gluten-free diet. If you do not follow the diet, it can progress into intestinal cancer. There are 2 treatments that can be to help treat celiac disease. The Celiac Spur Association books gives a long-term and a short-term treatment. The long-term is the obvious gluten-free diet. The short-term are steroids. I was put on steroids when I first was diagnosed with celiac disease to help with the inflammation in the small intestine, because that can also be causing some of your abdominal pain. After being on the steroids for a short time, the pain went away and things got better. There is no present cure for celiac disease, but research is always finding new information about the disease. Lifelong implications include that you always will have the disease no matter what throughout your life. As I said, there is no cure. You cannot grow out of the disease like you can for, say, asthma. There are 1 out of every 133 people in the United States that have celiac disease, and a lot of those are still undiagnosed. Things are becoming more popular for celiac disease, and more people are being diagnosed, and the groceries are having more food in normal stores instead of us having to go to special stores to get the food. My mother is the parent who passed the disease on to my sister, my 2 brothers, and myself. It can be easier having support from other family members when dealing with the changes of eating lifestyle. Because there are so many people in my family that have it, it is easier for us to deal with us. We're our own support system. When we go shopping, we buy things in bulk for all of us. Our family is also very supportive in dealing with this. The typical case of celiac disease does not exist. That means that no two people have the disease and have the same symptoms, or for that matter, have the same healing time or anything to do with the disease. Knowing facts and doing research is always very important when dealing with celiac disease.